Well, good morning. I'm Jagendra Rana. Topic of the day is climate change related health risks. Climate change related health risks. Climate change is increasingly impacting various aspects of life. And one significant area affected is public health. In India, the growing frequency of climate related events such as heat waves, floods, and air pollution is leading to a surge in health issues. Consequently, health insurance plans are becoming more expensive as insurers adjust premiums to account for these heightened risks and increased claims. So, climate change is influencing health risks in India, driving up health insurance premiums, and what this means for policyholders. So, the connection between climate change and health risk is there. Climate change is contributing to a rise in health issues, with several key risks becoming more prevalent. Heat related illness, increasing temperatures, and more frequent heat waves are leading to a rise in heat related conditions like heat exhaustion and dehydration, particularly among vulnerable populations such as the elderly. Then, respiratory problems. Climate change exacerbates air pollution, leading to an increase in respiratory issues like asthma and chronic obstructive pulmonary diseases. So, urban areas are particularly affected by rising levels of air pollution. Then, vector-borne diseases. Changes in temperature and rainfall patterns are expanding the range of diseases carrying insects, leading to a rise in diseases such as malaria and dengue. And waterborne diseases. Flooding and changes in water availability are contributing to the spread of diseases like cholera and diarrhea, especially in rural and underserved areas. And mental health issues. The stress and anxiety caused by climate related disasters are leading to a rise in mental health conditions such as depression and post traumatic stress disorder. So, there is an impact on health insurance premiums. As climate related health risk becomes more prevalent, they are directly affecting the cost of health insurance plans in India. Insurers are adjusting their pricing models to account for these risks, leading to higher premiums. Several factors contribute to this trend. Say, for example, increased limits due to climate related health issues. To rise in climate related health issues has led to an increase in number of claims filed by policyholders. So, this surge in claims is driving up cost for insurers, who in turn raise premiums to cover these expenses. Then, rising medical costs. Healthcare providers are facing increased demand for services related to climate change, leading to higher cost for treatments, medications, and services. So, these rising medical costs are passed on to consumers through higher insurance premiums. Then, adjustments in risk assessment model. Insurers are revising their risk assessment model to better reflect the heightened risk associated with climate change. Factors such as geographic location, exposures to climate related events, and the overall health profile of policyholders are now more closely scrutinized. Individuals living in high risk areas may see higher premiums as insurers account for the increased likelihood of claims and an introduction of new coverage options. So, in response to the specific health risk posed by climate changes, Some insurers are introducing new coverage options for our riders that address these threats. So these might include coverage for heart-related illnesses, air pollution-related treatments, or mental health support. While these options provide valuable protections, they also contribute to the overall cost of health insurance plans. Now, what policyholders need to know? With the rising health insurance costs due to climate change, policyholders need to take proactive steps to manage their insurance coverage effectively. Here are some key considerations. First, opt for comprehensive coverage. Given the broad range of health risks associated with climate change, it is crucial to choose a health insurance plan that offers comprehensive coverage, including hospitalization, outpatient treatments, and coverage for chronic and acute conditions. So the comprehensive coverage ensures protection against a wide spectrum of health issues, reducing the financial burden in case of illnesses. Then prioritize preventive care benefits. Look for best health insurance plan that offer preventive care benefits such as annual checkups, screening and vaccinations. Preventive care can help detect and manage health issues early, potentially reducing the need for more costly treatments later. And then ensure an adequate sum insured. As medical costs rise, it is essential to ensure that your health insurance plan provides an adequate sum insured. This will help cover the higher cost of treatment associated with climate related health issues and protect you from significant out of pocket expenses. Then regulatory review and update your policy. Regularly review and update your policy. Given the evolving nature of climate related health risk, it is important to regularly review and update your health insurance policy. This may involve increasing your sum insured, adding riders for specific risks, or switching to a plan that offers better coverage. And then explore medical reimbursement options. In the face of rising premiums, policyholders may also want to consider medical reimbursement options, which allows for the reimbursement of medical expenses not covered by traditional health insurances. So this can provide additional financial relief in the event of high out-of-pocket cost due to climate-related health issues. Because the climate change is not only an environmental challenge but also a significant public health issue with far-reaching implications for health insurance plans in India. As insurers adjust premiums to account for increased risk, policyholders must carefully evaluate their insurance needs to ensure adequate coverage. By choosing comprehensive coverage, prioritizing preventive care, and regularly reviewing policies, individuals can better protect themselves and their families from the financial impact of climate-related health risks. Because the climate crisis is also a health crisis. Higher temperatures, more weather extremes, and a greater number of climate-caused natural catastrophes are taking their toll on both our mental and physical health. So beyond the immediate death toll caused by heat waves, flooding and other extreme events, researchers say there is a broader trend of longer term health implications as a result of disruption to food systems, closer animal-human contact, and an increase in vector-borne diseases. This also includes many diseases and conditions we would not typically think of as climate-related, such as Alzheimer's and Parkinson's. So climate change is expected to cause approximately 250,000 additional deaths per year because of undernutrition, malaria, diarrhea, and heat stress alone, says the World Health Organization. A recent World Economic Forum report qualifying the impact of climate change on human health finds that by 2050 it will cause 14.5 million deaths and over 2 billion healthy life years lost. So the impact of this growing healthcare burden is likely to be uneven, but it won't be limited to those countries worst impacted by temperature rises. The pressure is on already stressed healthcare system around the globe to become more resilient and better prepared. Climate change and environmental degradation are affecting growing conditions and harvests for many crops, leading to food shortages and failed harvests. So by 2050, the risk of hunger and malnutrition could rise by 20% without action to mitigate the effects of climate change. The climate change and associated increases in climate variability will likely further exacerbate global health disparities. More research is needed, particularly in developing countries, to accurately predict the anticipated impact and inform effective interventions. So the problem in India is enormous, based on the potential for climate change and variability to exacerbate endemic malaria, dengue, yellow fevers, cholera, and chikungunya, as well as chronic diseases, particularly among the millions of people who already experience poor sanitation, pollution, malnutrition, and a shortage of drinking water. So, ongoing efforts to these risks have to be discussed. A universal theme of the recommendations to be developed, because the importance of improving the surveillance, monitoring, and integration of meteorological, environmental, and geospatial and health data while working in parallel to implement adaptation strategies is required. It will be critical for India to invest in improvements in information infrastructure that are innovative and that promote interdisciplinary collaborations while embarking on adaptation strategies. This will require unpredictable levels of collaboration across diverse institutions in India and abroad. Because more than 70% of the global workforce could be exposed to serious health hazards because of climate change, and existing occupational health and safety legislations may not be sufficient to protect workers, according to a new report by International Labour Organization. The report established that 18,970 lives and 2.09 million disability adjusted life years are lost each year as a result of more than 22 million workplace injuries that are attributable to excessive heat. So those most at risk of the effects of excessive heat includes agriculture workers and people who work in construction. Primary health impacts, according to the report, include heart stroke, cardiovascular diseases, and chronic kidney diseases. Construction and agriculture workers are also most at risk. So these diseases are also increasing at the same time, because these all are related to the temperatures. Temperature means with the waves, heat waves, it could be, because the change in climate is there, and climate change is increasingly impacting various aspects of life, and one significant area affected is public health in India. In India, the growing frequency of climate related events such as heat waves, floods, and air pollution is leading to a surge in health issues. So consequently, health insurance plans are becoming more expensive as insurers adjust premiums to account for these heightened risks and increased limits. The climate change is influencing health risk in India, driving up health insurance premiums, and what this and the policyholders are in a fix as to what they have to select in the coverage, because there is a direct impact on the health insurance premium also, and the number of climate change is contributing, like heat related issues, respiratory problems, vector-borne diseases, waterborne diseases, mental health issues. All these things are increasing day by day, and they are directly impacting on the health risk becomes more prevalent because they are directly affecting the cost of health insurance plans in India. So insurers are adjusting their pricing models to account for these risks, leading to higher premiums because there are several factors contributing to this. Uncaged claims due to claim related health issues, rising medical costs, adjustments in risk assessment models, introduction of new coverage options. So, with the rising health insurance cost due to climate change, policyholders need to take proactive steps to manage their insurance coverage effectively because they have to opt for the comprehensive coverage, they have to prioritize preventive care benefits, they have to ensure an adequate sum insured and regularly review and update their policies. They also have to explore medical reimbursement options because climate change is not only an environmental challenge but also a significant public health issue with far reaching implications for health insurance plans in India. As insurers adjust premiums to account for increased risks, policyholders must carefully evaluate their insurance needs to ensure adequate coverage. By choosing comprehensive coverage, prioritizing preventive care, and regularly reviewing policies, individuals can better protect themselves and their families from the financial impact of climate related health risks. Thank you. Thank you very much.